Hi, my name is Jerel Brandt and I'm a general surgeon. I'd like to talk to you a little bit about colonoscopies in case you're considering having one. By the time you arrive for your procedure, we like to say that the worst is already over, meaning you've taken your colonic prep and you're completely cleaned out. If you're not adequately cleaned out, it can increase the risk of us missing any tumors or masses and may necessitate a need for you to have a follow-up colonoscopy at an earlier date than anticipated. Once you arrive, you will meet the person doing your procedure, and that will allow you to ask any questions you might have prior to getting started. Once we get you back to the procedure room, we'll give you some medications that will allow you to relax and eventually fall asleep, so you won't remember what happens after that. Once we get started, we typically start with a rectal exam, feeling for any tumors or polyps or masses on the inside of the anal verge. Then we take our colonoscope, which has a camera on the very end. We cannot see out the sides, only what's directly in front of us. We gently push that up, over, and down to the first part of your large bowel. Once we get there, we blow your colon up with air like a hot dog balloon, and we back our camera out slowly in a circular fashion, looking in all the nooks and crannies of your colon for anything that might not be long. If we find anything, we do biopsy it and typically take pictures so that you can see what it looks like as well. If something is biopsied, that goes off to pathology, and it can take 7 to 14 days for to get those results back. Once we get all the way back to the first part of your colon where we started, we flip that scope back on itself and look where we were feeling to make sure we didn't miss anything initially. And at that point, we would try the scope and the procedure's over. You'll go back to the recovery area where you'll be monitored while you slowly wake up from your anesthesia. The risks of the procedure are bloating and gassiness, and some people do have some crampy abdominal pain afterwards. If you let that gas out, you typically will feel much better. Some people do notice some blood in their stool for the first 3 to 5 days after the procedure. If that happens, don't be alarmed. It should be minimal and it should stop on its own. If you have concerns, certainly feel free to give your provider a call. Anytime we blow your colon up with air like a hot dog balloon, we do risk putting a hole in your colon. If that happens, you do spend some time in the hospital with us, and sometimes you need a surgery to either repair that hole or resect that portion of your bowel altogether. Even more rare than that is bleeding from your spleen. The colon is attached to the spleen in the left upper quadrant of your abdomen, and sometimes as we're going around the corners of the colon, it can cause some tugging on the splenic capsule, and it can cause bleeding from the spleen. That's incredibly rare, but it is a possibility. Typically, you go back to the recovery room, and as you pass some gas and wake up from surgery, we'll give you something to eat and drink, and as long as you're feeling okay, we'll let you go home after that, and you can eat whatever you want the rest of your day. If you have any further questions, please feel free to ask myself or your provider of any details. Thank you.